Leber hereditary optic neuropathy. Introduction. Leber hereditary optic neuropathy, LHON, is a rare ganglion cell degeneration that typically affects the papillomacular bundle. The condition is caused by maternally inherited mitochondrial DNA point mutations, most frequently, 50 to 90%, at nucleotide position 11778, G2A, in the MTND4 gene. The condition typically affects males between the ages of 15 and 35 years, although in atypical cases the condition may affect females and present at any age between 10 and 60 years. The diagnosis of LHON should therefore be considered in any patient with bilateral optic neuropathy, irrespective of age. Diagnosis. Symptoms. Typically, acute or subacute severe painless unilateral, 50%, loss of central vision occurs. In initially unilateral cases, the fellow eye becomes similarly affected within weeks or months. Signs during the acute stage are often subtle and easily overlooked, and in some patients the disc may be entirely normal. Color vision is likely to be subnormal. There is often a relative afferent pupillary defect. In typical cases there is disc hyperemia with obscuration of the disc margins, Fig. 19.16a. Dilated capillaries on the disc surface, which may extend onto adjacent retina, telangiectatic microangiopathy, Fig. 19.16b. Swelling of the peripapillary nerve fiber layer, pseudoedema. Dilatation and tortuosity of posterior pole vasculature. Subsequently, the vessels and pseudoedema regress and severe optic atrophy supervenes, Fig. 19.16c, with nerve fiber layer dropout most pronounced in the papillomacular bundle. Telangiectatic microangiopathy may be present in asymptomatic female relatives. Surprisingly, the pupillary light reactions may remain fairly brisk. LHON+ refers to rare variants with additional manifestations such as neuromuscular dysfunction. Prognosis is poor, although some visual recovery may occur in a minority of cases even years later. Most patients suffer permanent bilateral visual loss with a final VA of 6/60 or less. The 11778 mutation carries the worst prognosis. OCT. Patients show peripapillary retinal thinning. Unaffected carriers frequently show variable thickening of the temporal RNFL, perhaps due to compensatory mitochondrial accumulation. Visual field defects usually consist of central or centrocecal scotomas, with preserved peripheral vision. FA shows no leakage from the disc or microangiopathic vessels. Genetic testing to look for the three common causative mutations. Treatment. Apart from symptomatic measures such as low vision aids, treatment is generally ineffective. Various vitamins and cofactors, idebenone, creatine and others have been tried with anecdotal success, and subspecialist prescription of one or more of these may be worthwhile, particularly in early disease or prior to second eye involvement. Counterintuitively, the cyanocobalamin, but not the hydroxycobalamin, form of vitamin B12 has been reported to worsen outcomes. Dietary deficiencies should be avoided, particularly of B12. Smoking and excessive alcohol consumption should be discouraged, theoretically in order to minimize mitochondrial stress. Idebenone appears to be neuroprotective in this condition and may have a role to play in some patients. Gene therapy is under active investigation.